Welcome.
Welcome.
Crystal's not feeling it today.
I'm not. It's been a rough week, man.
It's been a week. It's been a year.
It's mostly just been a week.
Well.
But yeah, it has been a long year, too.
Yeah. Yep. But guess what?
It's almost over.
It's almost done.
Multiple things are almost done, and I'm excited about it.
It's fair. That's fair.
Yeah.
So, Crystal picked our topic today. I don't know why.
I don't know either.
She picked it at random.
I was like, what are we going to talk about in the video today? And she's like, I don't know. That's a good question.
30 seconds before we go live, which is typically
It was like 3
do
minutes.
it. That's the amount of planning that goes into this.
Mm-hmm.
Yeah,
you guys are all very welcome.
Now you know.
Yeah.
Peek behind the curtain.
You don't want to do that.
Of the magic of the Crystal and Kelly show.
Oh, I get to be first?
Yeah. Okay. You're first alphabetically.
That's true.
By first and last name.
Yeah?
Mm-hmm.
I was going to say, unless you go by Dr. but C is before D, so.
See?
Never
No
mind.
matter what.
Yep. It's me.
You're number one.
Number one. Only in your book.
Aww.
Isn't that sad?
That's sad. So Crystal's feeling salty today.
I sure am.
So I said, what song are we going to play? And she's like, I don't know, something salty. So guess what I picked? She's not amused at all. Where's the salt? I'm not going to finish that.
No, you shouldn't. You better turn it off before Facebook flags it.
I still had like 3 more seconds.
Look, 2 people stopped watching you because of your
Wow.
dancing.
That's okay. That's
They
sad
didn't
for,
belong here.
sad for them. This is the wrong show for you. Oh man! So today that had absolutely nothing to do with what we're talking about. So
No.
because there's not really a song for thyroid disease.
I'm sure if you looked hard enough.
There's
something
probably
would.
some kind of
Yeah.
weird something. But today we're going to talk about hyperthyroidism.
It's snowing again.
Nice.
Snowing.
So what is hyperthyroidism? Crystal.
Are you asking me like the technical name?
The technical?
What's the one? Hyperadrenocorticoidism? What is that
That's
one?
Cushing.
Cushing's. We'll talk about that a different
We'll talk
time.
about that a different time. We'll do a whole series of
Yeah.
endocrine diseases, maybe.
Basically, hyperthyroid is where their thyroid is functioning too fast. It's like too well.
Yeah, it's producing too much thyroid hormone. Where is the thyroid gland located? Yeah, in the neck. So dogs have thyroid glands, cats have thyroid glands, we do. I think pretty much everything does. So the thyroid is responsible for producing thyroid hormone, which it affects like the whole body, like everything. So when we have issues with the thyroid, we see a lot of different symptoms because it's affecting all the different cells. What?
I was just thinking about you.
Uh-huh.
And you're hyperthyroidist.
Oh, yes, I have hyperthyroidism. It's controlled, but yeah, I have hyperthyroidism.
That just dawned on me now while we were sitting here.
Yeah.
You're like a cat.
Like a cat. So yeah, so that's one of the things to mention. So you can either have hyperthyroidism, so an overactive thyroid, or you can have hypothyroid, which is an underactive. Cats get hyperthyroidism. Dogs get hypo.
We have seen a couple dogs with hyper though.
Yeah, it's incredibly rare. And there is such a thing as cats getting hypothyroidism. It's just incredibly rare.
Yeah.
So in general, assuming that there's no like medicine that's causing it. You can get hypothyroidism in a cat because you over-treated them. Yeah, and same thing for dogs. If you're treating hypothyroidism and you over-supplement them, yeah, you can get hyper. That doesn't count. That's not real. That's just iatrogenic.
I have.
Ooh.
Look at the fancy word.
What does that word mean, Crystal? Do you remember?
Isn't it caused by medication?
Yeah, basically we caused it.
Yeah.
Iatrogenic. So hyperthyroidism is something that we see in cats. What symptoms do we typically see?
Weight loss.
Yeah, that's a big one. So they will typically lose a lot of weight, a lot of muscle mass, muscle wasting.
But they're eating very ravenously.
Yeah.
They're eating.
So they're eating a ton. So like
that.
just like that. I mean, that was me before I was diagnosed. So like before I was diagnosed, I was losing weight. People were like, "Ooh, girl, you've been losing weight. You look good." And I was like, I don't know why. I'm eating all of the Jack in the Box every day. I would eat like potato wedges and like 4 tacos and a jumbo jack, and like that was lunch.
And a drink. You just gotta have a drink.
And because like I was just burning all of the calories, and I was
nice?
so hungry. Unfortunately, there's other. I mean, it sounds like the best weight loss plan ever. However, there's other things that go along with that. So it caused a lot of muscle weakness because it was burning all that muscle because my body the metabolism was just so high. I couldn't eat enough basically, and so I was burning fat and protein. So that's not good.
Yeah.
It also will affect your heart. You'll have a high heart rate, high blood pressure. They will typically also have kind of nasty looking hair coats. Like they're just real coarse and dry and dull. Like your coat doesn't look good at all. Nails get really thickened and gnarly and good gnarly. That's a fun word. So those are the symptoms that we typically see. Sometimes we can feel palpate their thyroid gland, which you normally cannot do in a healthy animal. You usually cannot feel the gland, but if they have an overactive thyroid, a lot of times they have a goiter, so an enlarged thyroid gland, like I have right here. And now that's all anybody can see, so that's fun. You'll usually be able to feel it. So it'll feel on their necks, and sometimes you can feel that thyroid gland kind of pop through our fingers, and that's called a thyroid slip, meaning that it's enlarged and it just slips right through your fingers when you feel over it. Isn't that fun?
Super fun.
Super fun. So how do we diagnose it?
Blood work.
Specifically what?
Thyroid panel.
Yeah.
T4.
Yeah, so usually for cats, when we're diagnosing hyperthyroidism, a lot of times really all you need is a total T4. So just a baseline thyroid level, and that will be elevated. There's other changes that we can see on the blood work as well. A lot of them will have an elevation of one of their liver values, the ALT. Sometimes we'll also see elevated kidney values. Why?
Are they drinking more? Going to the bathroom more? Not drinking more?
No.
I don't know.
No. So the chronic high blood pressure can do a couple different things depending on how long it's been going on. So in early thyroid disease, the high blood pressure makes the kidneys kind of happy. And so it can mask any kind of early kidney failure. But later down the road, it actually causes kidney damage. And so then we can start seeing kidney failure along with the thyroid disease. And then that starts making things really tricky because as we start treating the thyroid, so we give them medication to decrease the amount of thyroid hormone that they're producing, it can either unmask kidney failure or it can make kidney failure worse. So then it's a fun balancing act. So that's super cool. Now, those two things don't always go together. The problem is this is something that happens in older cats. And so what happens also commonly in older cats? Kidney failure. So that's why we often see those two things go together, just not always. So that's why we don't always just do a thyroid level. We also want to see what those kidney values are doing for that reason.
Kidney disease can also cause a lot of weight loss as
it can.
well.
Mm-hmm.
So
yeah. So that's why we need to do a full blood panel to check all the things. Yeah. So, like I said, treatment-wise, it's medication to turn down the thyroid. That medication is called methimazole. The brand name is filimazole. If you do the tablets, they're really teeny tiny tablets.
they look like little pieces of candy.
They do.
They're coated.
Back in the day when you don't know what these are, they had the Lifesaver holes. So it was like the cutout hole from the Lifesaver. Like they sold them in like a little tube.
I mean, that's smart.
It's kind of, yeah, exactly.
Yeah.
I don't think they make those anymore.
Oh, because kids were probably choking.
Probably.
But that doesn't make sense.
But
Because
they were
they sell
delicious.
like those little root beer barrels and
These are smaller than that.
smaller.
Mm-hmm. Like literally the size of the center of a lifesaver. So
I
they
bet
were
kids were
tiny.
choking on them.
Probably. But you know, it was like what, the 80s or the 90s. That's fine.
People
We didn't care
their
about that
kids
then.
right?
Suck it up, you're fine. It'll dissolve eventually. But yeah, so they're teeny tiny little coated tablets. So they're usually fairly easy to give to most cats, but not all cats are really amenable to oral medication. Exactly. Or you could be a really big baby at taking pills like I am. So the alternative is for cats. I cannot do this. It doesn't work this way in me. So unfortunately, not a thing I can do. I just suck it up. In cats, we can get it as a transdermal gel. What does that mean? Crystal.
That means it's like a little turn dial, and you put it on the inside of their ear flap, the little ear pinna.
Who's here?
Oh,
Special guest, you gotta come
it's
say hi.
Mr. Dr. Hogan.
It's Mr. Dr. Hogan. You gonna come say hi?
No?
You're not? You refuse? You're just here to say goodbye? He's changing. So last night when I was going to leave,
Scoot on in.
the battery on my car was dead, so that was cool. So he's here to change the battery on my car.
Say hello to all
What a
of
good
our
husband
fans.
who's off for the week between Christmas and New Year's. Must be nice.
It is. It's fabulous.
So what's up? You want to talk about hyperthyroidism?
I would love nothing more.
What do you know about it?
I know it makes a thyroid hyper.
He's so smart.
Wow. That's
Makes the
why I
thyroid
married him.
overproduce
Yes.
thyroid hormones.
Wow. Good job.
Were you watching?
I was not.
He has literally never watched one of these videos. He's not on the Facebook.
That's ridiculous.
I am not on Facebook. I'm a rebel.
He is a rebel. Okay. Well,
You
that
got
was fun. Thanks for joining us. My little guest appearance. He says bye. God. Thanks for changing my battery.
This is really professional. You guys don't want to like kiss on the TV and all that too.
We're good. We're married. It's fine.
That doesn't happen, huh?
So what was I saying? Oh, transdermal gel. So what does that mean? Did you answer that?
I
don't know. I got
yeah,
distracted.
you put it on the inside of the ear flap and it just
Mhm.
absorbs
Yeah.
through their ear.
So it usually comes in like either a syringe or I like the little twist pens. So it's literally a pen with like a little applicator pad at the end.
Like a lip.
Yeah, it kind of looks like some kind of lip
Yeah.
gloss thing.
Don't
That
put it
you
on
just-
your lips.
Don't put it on your lips. So you just click it, like 2 clicks or 3 clicks, whatever the dosing instructions are. Rub it on the inside of the ear flap. Do not get it on your hands. That's why I like the pens that have the applicator tip instead of the syringes. Because with the syringes, you're supposed to wear like gloves or one of those little finger cut things so you don't touch it because you don't want that absorbing into your system. That would not be good. But yeah, it absorbs in that way. So that's really nice when we have issues with either giving pills by mouth or in cats, sometimes they'll throw up with the pills. So in those cases, we'll do the transdermal gel. Of course, it's more expensive, so that would be the downside to it. But it does work pretty well.
Yeah.
Mm-hmm. And then we need to follow up and
I was
recheck
just gonna say.
recheck a
Follow-up
thyroid level. Typically in a month or so, we'll recheck a thyroid level. We'll also recheck those kidney values. Because like I said, if they're already prone to kidney disease, sometimes once we start treating the thyroid disorder, we're unmasking. So it's not like the medication's not causing kidney issues. Those were already there. We just couldn't see them yet until we treated the thyroid. So that would be why.
That's it.
So, yeah.
There you have it.
There you go, and there you have it.
Words.
But no, there's another treatment. It's at
Oh,
the
you
end.
can have
That's at the end.
radiation or
Mm-hmm.
Yeah.
What kind of radiation? Like, I don't know.
Why do you always gotta make me look stupid on here? I don't know.
That's okay. So radiation, so not like for cancer radiation. This is a radioactive iodine called
Yeah.
I-131. So as a lot of people know, your thyroid needs iodine in order to produce thyroid hormone. That's why our salt is normally iodized. So that's
say it like that.
I don't know. It's a weird word. Straight away. So that's why our salt has iodine in it. So that we normally get a good source of iodine for our thyroid hormone. So what happens is they take this radioactive iodine, and where does it go? It goes to the thyroid gland. Cool, because that's exactly where we want it, and we don't want it anywhere else. And so it'll actually kill off the overactive cells that are there. And so that's really cool because then they're basically cured. It's something that is not cheap. I don't even know what it costs these days. I would say probably in the realm of like $1,300-1,500. Don't quote me on that. Don't call it to a specialty hospital and be like, Dr. Hogan said it was only going to be $1,500. I don't remember. I mean, that's an old number, so who knows?
That's exactly what you sound like. Do you know that?
I'm 240.
To everyone else,
Yeah.
you may think that sounds different, but that's what we normally hear.
Well, I'm about 300 years old, so that number could have been from the 1800s. I don't know.
Could have been.
I don't know. So, but close enough. Ballpark. Probably in the couple grand range, let's say. So that's why it's typically something that we'll do if they're on the younger side of things. So if it's like a 10-year-old cat, I think that's worth it. Because over the lifetime of that cat, medication cost and the follow-up visits.
Having to give it every day.
I have to give the medication every day.
Whatever.
Yeah.
Yeah.
It's like, well, we typically will start them on medication first, and then check their thyroid and their kidney values, and assuming that their kidneys are cool, then we can talk about radioactive iodine. But if you've got like an 18-year-old cat, probably not something we're gonna really talk about. So because like I said, it's pricey. They have to spend a couple days in the hospital because I believe Associated Veterinary Specialists in Bridgeton does that, along with, of course, Mizzou in Columbia. But yeah, I don't think there's really anybody else that's doing radioactive iodine right now. I could be wrong. It's not something we do frequently.
I don't think I've ever heard of anyone doing it.
Yeah, I've had a couple patients that did it.
Yeah.
But yeah, most people. For people too.
Yeah. Like, can't it kill off some of the good producing ones though too, and then you end up
They treat you with the radioactive iodine, it kills off like all of your thyroid, and then you go on thyroid supplement. The upside to that is,
your heart won't explode.
My heart won't explode, which is cool. I appreciate that.
Yeah.
I didn't go on thyroid supplement. There's fewer rechecks and less medication, just once a day instead of like a million times a day. So, yeah. I don't know. It's something to consider. We talked about it. I haven't pursued that. So, but yeah, so that's an option in cats as well. What else? What else is there an option for in cats?
Hearing about Cushing, we can't wait for that day.
Maybe we'll do that like week after next. Maybe next week we'll talk about hypothyroidism, and then we can talk about Cushing's, because those two things kind of go together. So
yeah.
But what other option is there for treatment? There's one other. Again, not used commonly, but
can you remove the thyroid?
So if it's because it's cancerous, yes. And we did have that one patient that had thyroid surgery because hers actually, she had thyroid cancer, but incredibly rare. Not what I was thinking of.
I don't think I know. Do I know?
You know, but you don't know that you know.
Okay. We'll tell the world what I know.
There is a prescription diet called YD that's made by Hills that in mild cases of hyperthyroidism can treat it. Again, still need to do follow-up and monitoring and things, and it may not be enough on its own, but yeah, that's another option, which is kind of cool because cats gotta eat. So, you know, if you're able to manage the thyroid with just that and not having to do medication, that's pretty cool.
Yeah.
Mm-hmm. That's it. I ran out of options to treat it, though.
Oh, well, that's okay.
I had a couple surprise ones.
Yeah?
Mm-hmm.
Mm-hmm.
Yeah, that was exciting.
Yeah.
So, any other questions? Anything else we need to mention about hyperthyroidism?
I don't think so.
I don't think so either. Certainly, if anybody thinks of any questions, let us know. Otherwise, next week, the plan is, like I said, we'll talk about hypothyroidism. So we'll talk about the dogs and what that causes and things that we see and how we diagnose it because it's a little trickier to diagnose. Cats, it's pretty straightforward. Is their thyroid level abnormal? Well, there you go.
Straight away.
Straight away. You know, straight away. I don't know why I have to say it with
I don't either.
British accent.
I'm just going to see how many videos I can say it on so that you will say it.
Awesome.
Straight away.
Well, everyone have a very nice new year. Stay safe.
Stay salty, my friends.
Stay salty. I think I'm just going to sit at home and watch movies and try to make it to midnight. It won't happen. It's fine.
I kind of don't want to be at home.
I'm old.
Well,
You can just come to my house.
okay.
All right. See everyone next week. Bye.
Let's see if I can hit the right button this week.